Imagine being in a deep sleep where you feel no pain, no discomfort, and time seems to pass in the blink of an eye. What if you were told this isn't a dream, but a medically induced state? This is what we call anesthesia. Anesthesia, a fascinating medical marvel, lets us undergo surgeries and procedures without the anticipation of pain. It is the guardian angel of modern medicine, silencing the screams of discomfort and replacing them with serene silence. But while it's a common term, many of us know little about it. We surrender to its effects, trusting in its safety. But do we really understand what it does to us? Have you ever pondered what really happens when the world around you fades and you sink into that deep, peaceful slumber? What does your body experience under the spell of these potent drugs? How does anesthesia work, and what exactly happens to your body when you're under its influence? Let's unravel the mystery of anesthesia. Anesthesia, a state of controlled, temporary loss of sensation or awareness, is a crucial part of many medical procedures. It's a fascinating field that seamlessly blends science, medicine, and human physiology. There are three main types of anesthesia: general, local, and regional. Let's delve a bit deeper into each one. General anesthesia is the most comprehensive form. It renders you unconscious, eliminating pain and awareness during surgery. It's like flipping a switch and taking a brief, dreamless nap, only to wake up when the procedure is over. On the other hand, local anesthesia numbs a specific area of your body, leaving you fully conscious. Think of it as a localized off switch, only affecting a small region where the procedure is taking place. It's commonly used for minor surgeries or procedures, like dental work or stitching a small wound. The third type, regional anesthesia, is a blend of general and local. It numbs a larger part of your body, like an entire limb or the lower half of your body. It's often used for surgeries on your arms, legs, or abdomen. You're awake, but the region being operated on is devoid of sensation. Now you might be wondering, who is in charge of all this? That's where anesthesiologists come in. These medical professionals are the guardians of your unconsciousness. They administer the anesthesia and monitor your vital signs during the procedure, adjusting the levels as necessary to ensure your safety and comfort. They're like the conductors of your body's symphony, maintaining harmony even when you're not aware of it. In essence, anesthesia is a complex and vital part of medicine that requires deep understanding and precise control. It's not simply about knocking you out for surgery. It's about maintaining a delicate balance in your body, ensuring your safety, and making the procedure as comfortable as possible for you. Understanding the stages of anesthesia is key to understanding its effects on the body. So let's delve deeper into these stages in our next scene. The first stage of anesthesia, known as induction, is a critical transition phase. This is when the patient moves from the conscious world into the realm of unconsciousness. Let's dive into the details. The induction phase begins with the administration of anesthetic drugs. These can be given intravenously, which is often the quickest and most effective method, or they can be inhaled through a mask. The choice of method depends on the patient's condition and the type of surgery being performed. As these drugs course through the body, they start to exert their effect on the central nervous system. The brain, the command center of the body, begins to slow down. The lights of consciousness gradually dim, like a city skyline at dusk. This isn't a sudden plunge into darkness. It's more of a gentle fade out, as if someone is slowly turning down the volume on your senses. You may feel a bit drowsy at first, like you're sinking into a deep, peaceful sleep. Your eyelids become heavy, your thoughts start to blur, and before you know it, you've crossed the border from awareness to unconsciousness. Physically, your body also undergoes a series of changes. The heart rate slows down, blood pressure decreases, and breathing becomes regular and controlled. These changes are carefully monitored by the anesthesiologist to ensure that everything is going smoothly. Psychologically, the experience of induction can vary. Some people may feel a bit anxious or disoriented as they slip into unconsciousness. Others may not remember anything at all. Rest assured, though, the anesthesiologist is there every step of the way, guiding you through this transition. Induction is like the prelude to a symphony. It sets the stage, fine-tunes the instruments, and prepares everything for the main performance. It's a delicate dance between the anesthetic drugs and the body, choreographed to the rhythms of the central nervous system. With induction complete, the patient is now ready for the next stage, the surgical stage. Now, the real work begins. The stage is set, the actors are in place, and the curtain is about to rise. The maintenance stage is where the real magic of anesthesia happens. This is the phase where you, the patient, are kept in a state of controlled unconsciousness. This is not just a simple sleep. It's a carefully managed state of unresponsiveness that allows surgeons to carry out their work without causing you any discomfort. During this stage, your body might as well be a symphony, and the anesthesiologist, the conductor. They are constantly monitoring your vitals, heart rate, blood pressure, oxygen levels, and adjusting the anesthesia dosage to keep you in that sweet spot of unconsciousness. It's a delicate dance of medicine and physiology, all performed with the precision of a maestro. The anesthesiologist's role doesn't stop at just maintaining your unconsciousness. They also manage your pain control, using a combination of anesthetics and analgesics. This ensures you're not only unaware of what's happening, but also free from post-operative pain. It's a bit like setting the stage for a pleasant dream, where you're blissfully unaware of the real world. The drugs used during this stage are typically delivered intravenously or through inhalation. The choice between the two often depends on the duration of the surgery, the patient's health status, and the anesthesiologist's preference. Intravenous drugs act quickly and can be easily adjusted, while inhaled anesthetics provide a steady state of anesthesia, ideal for lengthy procedures. But don't imagine that the anesthesiologist is merely watching over you. They're also coordinating with the surgical team, providing them with updates and ensuring the operation proceeds smoothly. It's a job that requires an intricate understanding of the human body, a keen eye for detail, and an unwavering focus. So, imagine for a moment the anesthesiologist, a maestro conducting a symphony of unconsciousness, ensuring you're comfortably adrift in a sea of dreams while the surgeons perform their life-saving work. It's a delicate balance, a dance with the unconscious mind, a testament to the marvels of modern medicine. Maintaining the perfect balance of anesthesia is a delicate art, but what happens when it's time to wake up? Emergence, the final stage of anesthesia, is when the patient begins to wake up. The anesthetic journey is a fascinating one, and this phase is no exception. It's not merely a case of lights on, curtains up. It's a carefully curated process that involves the reversal of anesthetic drugs and the gradual return of consciousness. As the anesthetic drugs are adjusted, the patient transitions from a state of induced unconsciousness to a state of wakefulness. This doesn't happen all at once. It's a slow and steady process, tailored to the patient's individual needs and the nature of the procedure they've undergone. This is where the expertise of the anesthesiologist comes into full swing, as they skillfully manage the fine balance between too much and too little anesthesia. Now, waking up from anesthesia isn't always as smooth as falling asleep under it. There can be potential side effects and complications during emergence. Some patients may experience what's known as emergence delirium. They may feel disoriented, restless, or even exhibit combative behavior. This is usually a temporary state, and healthcare professionals are well prepared to handle such scenarios. Other complications can include post-operative nausea and vomiting, a common occurrence that can be managed with medications. In rare cases, there can be serious complications like respiratory problems or an unexpected reaction to the anesthesia. But don't let these potential side effects alarm you. The field of anesthesiology has progressed leaps and bounds over the years, and the chances of experiencing severe complications are incredibly low. Anesthesiologists are highly trained professionals who are equipped to handle these situations and ensure the safety and comfort of the patient. So, as the patient's senses start to return, their awareness slowly regains footing, and they find themselves back in the waking world. The stage of emergence may be the final step in the anesthetic journey, but it's by no means the end of our exploration. Emergence marks the end of the anesthetic journey, but our understanding of anesthesia doesn't stop here. Anesthesia does more than just put you to sleep. It has a profound impact on your body. Let's start with the brain. Anesthesia effectively switches off certain areas, leading to a state of unconsciousness. It also reduces the brain's ability to process information, hence the lack of awareness and memory during surgery. However, this is not without risks. Prolonged use of anesthesia can lead to cognitive decline, especially in the elderly. There's also the rare but terrifying phenomenon of anesthesia awareness, where a patient remains conscious during surgery. Moving on to the heart, anesthesia can affect the rhythm, rate, and function of this vital organ. It can slow down the heart rate and lower blood pressure, which is usually harmless, but can be concerning for those with pre-existing heart conditions. That's why it's crucial to inform your anesthesiologist about any heart issues ahead of the procedure. Anesthesia also impacts the respiratory system. It relaxes the muscles, which can lead to decreased respiration and potential complications, like lung infections, especially in smokers. It's another reason why anesthesiologists monitor patients so closely during surgery. The liver and kidneys, responsible for metabolizing and excreting the anesthesia, can also be affected. Patients with liver or kidney disease may have a slower recovery from anesthesia and a higher risk of complications. And let's not forget the digestive system. Anesthesia slows down the digestive process, leading to potential issues like nausea, vomiting, or constipation after surgery. But despite these potential risks and complications, anesthesia is incredibly safe when administered correctly. The risks are low, especially when compared to the potential dangers of undergoing surgery without it. So, the next time you go under anesthesia, remember, it's not just a deep sleep. It's a carefully controlled, medically induced state that allows doctors to perform life-saving procedures. Anesthesia is a fascinating field that combines science, medicine, and a bit of mystery. As we've journeyed through the stages of anesthesia today, we've seen just how complex this process truly is. It's not simply about putting someone to sleep. It's a calculated, meticulously planned progression that ensures a patient's safety and comfort during surgical procedures. We began with the first stage, induction, where the body is gently ushered into a state of unconsciousness. This initial phase is crucial as it sets the tone for the rest of the procedure, helping to alleviate anxiety and prepare the body for what's to come. Next, we delved into the maintenance stage. This is where the real magic happens, as anesthetics maintain a steady state of unconsciousness. It's a delicate balance, a dance of sorts, between keeping the patient unconscious and ensuring their vital signs remain stable. Emerging from the depths, we then looked at the third stage, emergence. This is when the anesthetic is withdrawn and the patient gradually regains consciousness. It's a critical time, as care providers monitor for any signs of complications, ensuring a safe return to the conscious world. Throughout this journey, we've seen the profound effects of anesthesia, both on the body and the mind. It's a tool that, while rendering us unconscious, paradoxically illuminates the incredible intricacies of our biological systems. But what does all this mean? Why is understanding anesthesia so important? Well, anesthesia is more than just a medical procedure. It's a cornerstone of modern medicine, enabling surgeons to perform life-saving operations that would otherwise be too painful or stressful for the patient. It's a testament to the power of medical science, its ability to delve into the unknown, to manipulate our biological processes for our benefit. In the world of medicine, anesthesia remains one of the most intriguing and vital components. Understanding it helps us appreciate the complexity and beauty of medical science. As we continue to unravel its mysteries, we inch closer to a deeper understanding of ourselves and of the world we inhabit.